Hi, folks. We'll be getting started in just one moment. Thank you. Good morning, folks. We'll be getting started in just one moment, just waiting for a few more people to join us. Good morning, folks. We'll be getting started in just one moment. In the meantime, if you all want to drop in the chat who you are, where you're coming from, that would be awesome. We'll be getting started in just a minute. We'll be getting started in just a minute. Thank you, everybody, for joining us for our webinar on uplifting contextual and experiential evidence. It's always exciting to see so many people that are interested in evidence.
So I think we will get started. So great to see you all this morning, this afternoon. Thank you so much for joining us for our second webinar in our Uplifting Contextual and Experiential Evidence series and project. We are so excited to share with you our speakers today and everything that we've been working on from the last webinar. So today we're going to be talking about integrating and weaving evidences into practice. I'll pass it to my colleague Sophia to share us some logistical things, and then we'll get started.
Thanks, Vibhuti. So for our agenda for today, we're going to have our introductions and our welcome, share about the background on the Uplifting Contextual and Experiential Evidence project, do some speaker introductions, have a Q&A with these speakers, and finish off with the closing remarks. For our objectives, to share ongoing work on the Uplifting Contextual and Experiential Evidence project, join a conversation with Dr. Kathryn Bocanegra and Fareeha Waheed, who will share successes, challenges, and strategies for weaving all three forms of evidence presented in CDC's framework for thinking about evidence. Here is the Prevention Institute team that's been working on the UC project. We have Sheila Savannah, Ruben Cantu, Vibhuti Kacholia, Sofia Bateo, and Grace Guerrero Ramirez. And finally, this is just an acknowledgement of our COAG agreement for this project, working and being supported by CDC. With that, I'm going to pass it back to Vibhuti to share a bit more about the background of UC.
Awesome. So for those who didn't have a chance to join us in webinar one, or maybe newer to the project, we want to provide a quick background and overview of the project before we get started. So evidence-based policies, projects, and practice have quickly become the standard in proposals, funding, opportunities, and more, as both the case in government funding as well as philanthropy and foundations. So 13 years ago, the CDC published framework for thinking about evidence to give guidance about evidence-based decision-making and describe 3 forms of evidences: best available research evidence, contextual evidence, and experiential evidence. And we'll drop in the chat a bit about the CDC framework. So last year, Prevention Institute developed a series of health equity and practice modules, which are on our website. We'll also drop that in the chat. And during this project, we saw a need to elevate health equity and racial justice in all of our work, but specifically in our partnership with CDC and how it's important for community safety and violence prevention work. So this all laid the foundation for the Uplifting Contextual and Experiential Evidence project, UCEE, that seeks to understand how organizations are uplifting and integrating contextual and experiential evidence into their programs and their practices. So we've developed an internal landscape scan and conducted subject matter expert interviews and shared those findings in webinar 1. And currently we are working towards a final report for best practices and recommendations that we will share in our 3rd and final webinar. So these are the principles and strategies that we produced from our landscape scan and our interviews. And we believe that these strategies can help community organizations, health agencies, funders, and others intentionally uplift contextual and experiential evidence and integrate them into decision-making. We presented these principles and strategies in webinar 1, and our respondents from our Zoom polls helped us currently understand how these strategies are being used in practice in the field. So you'll see the percentage next to each one of the strategies. That's how many folks are currently using these strategies in their work. We also wanted to share some interesting feedback from folks from webinar 1. We did many Zoom polls and we appreciated everyone's engagement. And what we learned was about a fourth of the respondents, 22%, had 0 experience in uplifting contextual and experiential evidence, and the 3 forms of evidence was new for them. Over 75% of respondents believe that federal agencies and state health departments were the most pivotal in driving change and weaving all 3 forms of evidence for decision-making. About half of the respondents believe that community organizations, philanthropy, and other non-government funders, as well as academic institutions, were also pivotal in driving change. And out of the 4 principles, respondents ranked shifting investment, ownership, and action to community as the most essential for changing practices in decision-making. So participants are, as I said, very engaged in sharing their challenges when they take this approach to their work. And the largest challenges they shared were lack of sustained, flexible investments into community-centered work, compensating community for engagement and experience, and the lack of strategic planning and buy-in protection. So the goal of this project is to demonstrate how the public health field can and must move towards a weaving approach for all 3 forms of evidences for a balanced paradigm of valuing and integrating. So we look forward to sharing our findings, recommendations with you, but we are excited today to hear from experts doing this work in the field right now and how they're navigating their successes and their challenges. I'm going to pass it to Ruben to introduce our speakers for us.
Great, thank you, Vibhuti. And definitely, I just want to remind folks to utilize the chat and let us know if you have any questions that are coming up as we're sharing with you all and as our speakers are sharing. We'll be monitoring that and we'll be, raising some of those questions as they come up. So we're going to be hearing from 2 really great speakers today on their experiences using different forms of evidence in their work. So the way we're going to go about this is we're going to have each of our speakers share a little bit about how their work has been informed by utilizing experiential and contextual evidence. Then we're going to move into a little bit of a discussion and a conversation with them together. So like I said, please share any thoughts or questions as they come up in the chat and we'll loop back around to them. So first off, we're going to hear from Dr. Kathryn Bocanegra. Dr. Bocanegra is an assistant professor at the Jane Addams College of Social Work at the University of Illinois, Chicago. She's a licensed clinical social worker and also serves as a senior advisor to the Illinois Attorney General on crime victim and violence prevention issues. Dr. Bocanegra has over 18 years of community-based mental health and violence prevention experience and specializes in working with survivors of violent crimes. She's published book chapters and articles examining the intersection of the criminal justice system with urban neighborhoods. Dr. Bocanegra was also co-chair of Mayor Brandon Johnson's Public Safety Committee, who's been appointed to several violence prevention and criminal justice commissions. Her current research focus is on street intervention and trauma exposure, homicide investigations, and the experiences of criminalized survivors. So Kathryn, we're gonna turn it over to you to share a little bit about some of your work.
Excellent. Thank you so much, Ruben, for the introduction. And I want to thank also Vibhuti, Sophia, Grace, and Sheila for your support and invitation to contribute to this webinar. I'm very excited to be a part of this collective and to partner with the Prevention Institute on what I believe is one of the best titled webinar series I've ever been able to contribute to, that I think is so timely and so important. So I do not have slides for this component, although I will be sharing slides in some of our Q&A to illustrate some of the projects and approaches that I want to briefly share with you about my experience, my expertise, and how do I try and bridge the research and practice realms through grounding contextualized evidence to develop strategies to make communities safer, disrupt cycles of harm, and support those who've been affected by violence. So as Ruben shared, I am an assistant professor at the Jane Addams College of Social Work at the University of Illinois, Chicago. It's the largest public university in the city of Chicago, and I've been there for 4 years. And before coming into higher education, as noted in my bio, I came from community practice. I first started in community mental health, and I worked in community health for several years and then transitioned into community violence intervention practice. That transition occurred when I realized that the majority of the people that I was working with, both adults with severe mental illness and children and adolescents who are experiencing traumatic stress, that the origin of their wellness issues came from exposure to violence in their home and in their communities and through their contact with systems, which included their schools, their criminal legal system, and even healthcare facilities. And so I realized that I was downstream from where I wanted to be professionally and wanted to move upstream to disrupt those cycles of traumatic stress that landed people on my caseload as a mental health practitioner. So I started in community violence intervention practice in 2009 and ran a whole host of prevention and intervention programs, starting with early childhood abuse and maltreatment, to school-based initiatives, safe passage programs, gang intervention programs like the Cure Violence model, and then starting neighborhood coalitions to both generate a collective voice and a collective agenda around the issues that the neighborhoods I was working with were experiencing to change the systems that were responsible and contributed to some of that systemic harm. So over that practice experience was a continued engagement and frustration with researchers. So I consider myself to be part of what I call the dark side when I was in community practice, because I was continually frustrated with researchers who I would engage to try and help me answer questions I had around what was happening in my community practice experience, and upset and frustrated by the ways that they engaged community. First, I'll share 2 examples and then now describe very briefly how I've tried to use that experience to inform my research agenda that is relevant to the conversation we're having today in the webinar. When we first started doing youth-based school safety initiatives, one big issue that came up was how youth navigate their community. There were areas where they felt safe. There were areas where they felt at heightened risk of violence. And I thought it was important for us to create these maps of youth perspectives to help us as youth advocates and service providers more effectively negotiate safe passage zones within the community and allocate resources in areas where they felt increasingly vulnerable but also to understand what makes young people feel safe in some parts of their community versus others. And so I approached 3 different research universities in Chicago, and we have many and very many prolific researchers on this topic who all told me you should just use police data and look at where there's shootings and homicides, and there you know where young people feel safe and don't feel safe. But the use of law enforcement data and youth perspectives to me seemed like a mismatch. And so it wasn't until I engaged actually a psychology department in Loyola University that they sent a group of graduate students to do cognitive mapping exercises with young people. And we used interactive tablets where young people mapped out, this is where I feel safe. This is where I will walk 18 extra blocks to get to school just so I can avoid going through this one area for these reasons. We then translated this cognitive mapping exercise with young people into a youth safety map for the neighborhood. And so when additional resources came in, we could allocate those resources to areas where youth felt vulnerable, and we had a better understanding of where young people felt safe. And then we layered on, at the end of that project, we layered on the law enforcement data and found that in areas of shootings where there's concentration of shootings and homicides were not necessarily where young people felt most vulnerable. It was around gang boundaries, it was around areas with poor lighting, and it was areas where there was low level of adult presence or supervision. And that didn't map on with the law enforcement data. A second example of how I became frustrated as a community practitioner with the way in which the perspective of community members and the experiential evidence of their lived their stories, right, was, I felt like, ineffectively engaged by a research institution, came to when we had conversations around investing in community violence intervention programs. I, at that time, had been asked to be a part of a 2015 Governor's Commission on Criminal Justice and Sentencing Reform, which I'll talk about when we get into the Q&A a little bit. And this was a statewide commission in which the governor had set a goal of reducing the Illinois prison population by 25% in 10 years. And at that time, there were about 48,000 individuals sitting in Illinois state penitentiaries. And of course, the biggest concern the elected officials who were part of that commission is, how do you reduce prison populations while maintaining public safety? Because having people in prison cells was equated with safer neighborhoods in that time. And I presented the argument that came from the coalition work that I was doing in community, was that investing in communities and investing in the root causes of violence could provide a safer and more cost-effective alternative to investing in putting people in prison cells. And I was challenged openly in that meeting, saying, I just don't understand what is the role of community, of government in investing in community, and how will investing in community make community safer? We need these systems which we've created, like the criminal legal system, like prison cells, like law enforcement, in order to facilitate safety. And so it was at that time that I became aware of a very comprehensive trauma recovery center model that was actually generated from the University of California, San Francisco, that provided these wraparound services to survivors of violent crime. And I invited them to come and present to the committee to demonstrate how, from the experiences of survivors who had benefited from those programs, that when you invest in programs in community, especially among people in communities who have been historically marginalized, that have been disinvested in, that you can disrupt cycles of harm, and that over the long course of time, like over the course of 10 years, when you're trying to reduce prison populations, that you see a reduction in violent crime, a reduction in victimization, and all positive indicators and all the public health outcomes we care about. And I'm happy to say that to this day, because of the advocacy efforts, I think of several committee members, not just myself, and bringing in experts from other parts of the country to share that there's another way that we can think about wellness and safety and community investment. We have now seen the proliferation of the Trauma Recovery Center model in Illinois. The Illinois prison population has been reduced by 25% in 10 years. And then we can talk about data on how we're tracking violent crime and homicide rates, because there's debate on that. but at least we're seeing the community investments that we know disrupt the cycles of harm. So those community experiences I brought with me into higher education. And my goal was first to maintain accountability and transparency to the community members and the communities that I had worked in. And the second thing, which is highly discouraged in higher education, is to remain connected to community practice as well. Because there is this expectation in some academic disciplines, even in social work, the academic discipline in which I find myself, is that once you are in a research position in higher education, you are like an anointed expert and you will always remain so, even if you become disconnected from a community of practice. And so through each research project that I've engaged in, I have tried to think about what could be free exportable tools that can be easily accessed and engaged by community members. The second part is to make sure that there is oversight in every aspect of the research that I do from those who are directly impacted by the issue that I'm researching. And the third part is to continually engage community members on that topic so that something's not just out there as a static research project, but it's continually being revised and updated so that it's relevant and responsive to the needs of the field. So in the chat, I'm just going to put one example of a resource that I'm thankful that I was able to develop, actually 2 resources. So one was a website, it's called streetsupport.org. This came from my practice experience of supervising community violence intervention workers and recognizing the traumatic stress they experience, that there needed to be ways for organizations to think about how they could comprehensively support frontline workers who are putting their lives on the line every single day to disrupt cycles of violence in communities. So this website that's in the chat provides a toolkit, if you click on the resources tab, that allows for organizations to begin to have conversations around how they can develop healing-centered trauma responsive practice. Those training modules were developed from the research that I conducted, comprehensively engaging community violence intervention workers in Chicago and examining through in-depth qualitative interviews the traumatic stress they experience on the job and what supports they wanted to manage that traumatic stress. And I can tell you, an EAP plan never came up once in that research, neither did yoga or bubble baths. So what they largely talked about is the supports that they wanted to manage, to address the traumatic stress they experienced was a healthier workplace because they knew that what happened in the community was outside of what they could control. A second research product is what I call this first ever survivor-centered advocacy or legislative database. So if anyone here has worked with survivors of violence, you know that there's this website maybe called Victim Law, which you need basically a law degree or you need to have experience as a paralegal to understand the legislation that is distilled on this website. So what I found from working with survivors of violence, both in community practice and through some of the governmental work that I've done, is that survivors are largely unaware of the vast amount of legislation that exists both at the state and the federal level to support them, that articulates a right, and that there are intermediaries in communities that interpret legislation for them that prevent them from accessing support and help. So for the example of crime victims compensation, sometimes survivors are told by law enforcement, by funeral homes, by hospital employees that if it was a gang-related case, they should not apply for crime victims compensation because they will not be awarded. But if you read the legislation in Illinois, that is not indicated. So the goal was to first translate policy into more accessible language, then to organize policy in a way that articulated and responded to the needs of survivors, right? And then to give survivors and their advocates tools to effectively navigate the policy environment that constructs rights and their access to rights and services in the state. So the Illinois Survivors website, which is in the chat, is another example of how that critical research examining Illinois legislation, followed by a comparative case study of 2 neighborhoods in Chicago and examining how survivors of violence navigate services and experience roadblocks to access, can then inform a policy and advocacy guide on that end. And then we're also developing a set of trainings for victim advocates to help them accompany and advocate on behalf of survivors within that policy framework and with the intermediaries and stakeholders who interpret policy for them. So thank you for that, allowing me that monologue, but I'm hoping you also use those resources if they're relevant to you. And I'm excited to hear more about Fareeha's work and to share more with you in the Q&A.
Kathryn, thank you so much for sharing all of that. I'm pretty sure that the story that you shared and your experience, I'm sure that with our audience, it's definitely resonating, a lot of what you shared. And just FYI, so another project that Prevention Institute is involved in right now is a project called Sync Safety. So that's Strategies for Youth and Neighborhood-Centered Safety, which is another CDC-supported project where we're bringing together a learning community of 30 Black and Brown-led community-based organizations that are working on a public health approach to preventing violence and to building community safety. Kathryn is part of that. In total transparency, Kathryn is also part of that project as one of the evaluators, and we're so glad to have your experience and your stories that can help inform how we're looking at the other work that we're doing as an organization and as a broader community that's working on preventing violence. Because I think there's a lot that we can all continue to learn from. So thank you. Next, we're going to hear from Fareeha Waheed. Fareeha is an educator, a labor leader, and a community advocate in Baltimore, Maryland. A Pakistani American immigrant with a passion for health and educational equity. She's the vice chair of the Baltimore Teachers Union and co-chairs the mayor's Trauma-Informed Care Task Force in Baltimore City. Fareeha holds a bachelor's degree in psychobiology, a master's degree in education, and is pursuing her doctorate in urban leadership at Johns Hopkins. She's taken part in local to international conversations on race, trauma-informed care, health and educational equity, using community voices in decision-making, and fighting for liberation. Fareeha has advocated for safe and affirming schools, clean water, access to resources for staff and students during the pandemic, restorative justice crisis response, transparency in government, wraparound supports, keeping community schools open, maintaining comfortable learning temperatures in school buildings, and much, much more. Fareeha has been part of some of the conversations we've already had to inform the work that we're doing on this project. So we're really excited to invite her to share a little bit about the work that she's done and how that work has been informed by uplifting different kinds of evidence, particularly community voice. So Fareeha, please share with our audience.
Thank you, Ruben. Good morning, everyone. I'm in Baltimore, Maryland, so it's afternoon for me, but it's great to see everybody no matter where you are, whether it's the West Coast, East Coast, or somewhere else. I'm really glad to have you join in the conversation today. And I really encourage everybody to use the chat box. I don't really want people to just get knowledge from me and Kathryn. I think this is really an opportunity to get just collective knowledge and expertise from everybody in this webinar. So I invite you to use the chat box to share commentary and your own resources and best practices too. As Ruben shared, I'm really working at the intersection of educational equity, health equity, and policy, and really working to make sure that we're operating as a unified front across Baltimore City, rather than a lot of the siloed work buckets that I've been noticing when I first got to Baltimore. This is now my 10th year in Baltimore. Most recently, I've had the privilege of getting nominated and confirmed to co-chair Mayor Brandon Scott's Trauma-Informed Care Task Force. That is just a wonderful opportunity. We're actually the first state in the United States to comprehensively legislate trauma-informed care. So I'm very, very passionate about this topic. And it actually goes all the way back to 2014 when I first started working in a classroom. I got to a classroom, there were mice droppings all over my room. There was lead poisoning in our water pipes. We had no health suite for our students to get any like nursing supports or any medical supports. And I also noticed in talking to my students that they could just not engage with all of the demands of a classroom and with the learning environment because there were just so many adverse childhood experiences and so much trauma really happening in their lives. When I spoke to my students and their families, it became really, really clear that this was certainly not gaps in IQ or intellect. It was really just gaps in opportunity, particularly health equity, that was actually leading to gaps in educational equity and opportunity. So very early on in my career, I recognized that we really do have to work closely across different sectors. People in education can't work alone. People in public health or healthcare can't work alone. We're stronger together. So in talking to my students, I really repeatedly heard a number of societal problems that they were really grappling with. I had students as young as middle schoolers and late elementary schoolers who were getting pulled into gang activity and having to make the difficult choice to sell drugs on the corner because they had to figure out a way to make ends meet for their family so they could have shelter and access to food. I saw a number of students and families really caught up in the cycle of substance use disorder and seeing the disastrous impact of zero tolerance policies, which were actually not coming from an equitable public health approach. I saw just violent crime. I actually saw people get like shot blocks away from my school. I would hear gunshots repeatedly as I was teaching. And just so much more. There's mold going on in our classrooms, asbestos, just all of the collective impact of these traumas was really, really clear. It was creating a lot of inequities for all of our students. So I knew that I couldn't solve this problem from the four walls of my personal classroom, and my experiences were not isolated to my classroom or to my school community. It was actually the experiences that we were hearing from across the entire city. So Ruben and the team are about to play a little video that just shows you a little bit more about the origins and kind of how we came up with this like legislative idea to really pursue trauma-informed care through passing statewide legislation and creating the Elijah Cummings Healing City Act, or what we also call as the Mayor's Trauma-Informed Care Task Force in Baltimore City. And I think it's perfect to play this video in this webinar because you'll actually get to hear from people who hold more contextual and experiential evidence in this body of work than I do. I was born in Pakistan, so I'm certainly, Baltimore is now home, but I've lived here for 10 years. I've definitely not been born here. So I love to amplify and just give opportunities for people who are actually from Baltimore, especially Black Baltimoreans, since historically they have been the ones who have been most marginalized. And I also just love to elevate experiential evidence, people who really understand what is happening in Baltimore City, who have really been working and living in Baltimore City across multi-generations. So with that, I'm going to have them share the clip with you.
After a shooting at the Frederick Douglass High School in February of 2019, students from Douglass showed up to a hearing at City Hall to share their thoughts about what needed to be done.
Just knowing that we dealt with so much trauma outside of schools, gun violence, homelessness, food insecurities, it just really impacted how we went through life and how we saw things and how we experienced things. And just knowing that we had to go to school and deal with the same things that we were trying to escape from in real life, it made things a lot harder for us.
A lot of the adult conversation at the time was centered on, should we have more metal detectors? Should school police be armed while they're in the school building? But when the young people got up to testify, they wanted nothing to do with that discourse. They were very clear. They wanted their city council to stop focusing so much on how to police them, but to instead focus on how to prevent these types of horrific events from occurring. We believe that the best policy comes from people who are most impacted by the problems. And so we wanted to make sure that community was at the table all the way through. And as we did this listening tour, what we saw is that people wanted to be a part of it. Folks from barbers and beauticians like Troy and Donna to amazing mindfulness organization, to students, to returning citizens, everybody was saying, we want to be part of this movement for healing in our city.
A Healing Day Summit took place at Coppin State University, where the community came together to provide resources in a celebratory atmosphere. And later that afternoon, hundreds marched to Frederick Douglass High School, where the now named Elijah Cummings Healing City Act was signed by then Mayor Jack Young, the only bill in the country that legislates trauma-informed care. Since the signing, a lot has been happening in Charm City, including a trauma-informed task force, truth and healing community conversations, and trauma-informed care training began occurring at city agencies. The Holistic Life Foundation, a Baltimore-grown organization known for the mindfulness work it was doing in Baltimore City schools and around the world, was tapped to provide the training.
Through this initiative, we've been able to go in and train all the heads of city agencies in, elementary yoga and mindfulness. The next part of the initiative is going into the libraries, training the librarians up in first self-care, because we always start off with self-care, and then elementary practices.
Donna Bruce, a master hairstylist and lobbyist in the fight against sex trafficking, was named to the Trauma-Informed Care Task Force. She is also a certified peer recovery specialist at the Penn North Library.
We have doctors from Johns Hopkins, we have surgeons, we have social workers, we have teachers. And just to have be amongst a great set of people coming from different perspectives and different backgrounds. So I'm coming from a person with lived experience, meaning that I know firsthand what trauma looks like. I know firsthand what it feels like to hurt. And then you find out that it may be a doctor that went through something that was similar to me. And it's like, wow, but we came from two different places. The fact remains that trauma is still the same and healing is possible.
This Healing City movement has helped me realize that trauma is a very deep-rooted issue, and it's very important that we acknowledge it first in order to heal it, because if we don't know it's there, then we don't know how to change the trajectory of things. So yeah, Healing City has helped me heal.
Thank you. So as you can see from that video clip, I love that video clip. And actually, Brianna, one of the students who really championed getting city council to actually listen to students around the importance of trauma-informed care and actually putting holistic wraparound supports in place. Brianna, she went from, us teaching her how to make public testimony to now actually working on staff with Healing City Baltimore. Since then, she's graduated high school. She's gotten into college, and she's now actually joined our movement and our team and continues to stay deeply connected and actually has a leadership, seat in this body of work. So I think that is just so beautiful. I also want to just speak to the unique group that exists on the task force and in Healing City Baltimore. This is my 10th year in Baltimore. And I joined the Trauma-Informed Care Task Force when it was first brought around. I was part of the first original group of people who really got inaugurated into the opportunity. We're now entering our 3rd year of implementation. And I went from chairing our diversity, equity, inclusion work and co-chairing our policy work to now co-chairing the entire Trauma-Informed Care Task Force, along with City Council person Z. Cohen, who actually just won the primary to become city council president. So what we have proven is that this model works when you bring trusted community leaders into the mix, when you give them a seat at the decision-making table, when you collectively do a landscape analysis and really figure out who are all of the stakeholders, not just federal partners or state partners or partners in government or in the health department, but when you expand that stakeholder group to include people who've been historically left out, you're just more likely to build a better vision, a vision that actually captures the root causes and the problems that are plaguing just Baltimoreans across our city. And together we have shown that, it is possible to sustain this work and it is possible to keep growing and scaling this work.
Fareeha, thank you so much for sharing that great video. It was great to hear the different voices represented there. And I will, again, in full transparency, Zeke Cohen spoke at a webinar of ours probably about 4 years ago now. And he just struck me as the kind of servant leader, like a former educator himself, who really does what he can to like make space for the voices of community and the work that you all are doing. And you definitely are doing that as well in everything that you do. So thank you for doing that. We're gonna move into a little bit of a conversation here, and I'm gonna ask and see if it's possible to spotlight myself and Kathryn and Fareeha so that you all can see us a little bit better if we can, and if we can't, then it's not a problem. As we kind of move into the conversation. So I'm curious, and I'm gonna pose this question first to Fareeha, and then Kathryn. Please feel free to jump in as well. But I'm curious if you can give a specific example of when you've been able to leverage contextual or experiential evidence, so like lived experience, to contribute to some sort of a decision-making opportunity that's presented themselves. And are there any specific strategies to do that you found to be really successful?
Yeah, that's a great question, Ruben. And I think just the entire body of work, Healing City Baltimore and the Trauma Informed Care Task Force, we really have been working to leverage and uplift both contextual and experiential evidence. We actually most recently just won the Robert Wood Johnson Foundation Culture of Health Equity Prize. It was awarded to, I believe, 9 different cities across the nation, and Baltimore was very, very lucky to receive it because of the work that we're doing on the Trauma Informed Care Task Force and just with Healing Baltimore. So, you know, through that, I really learned that it's important to come up with a plan to actually just not be flying by the seat of your pants, but really to come up with an equitable plan to engage the community and really to consider what is the specific purpose of the engagement? Like, who are the groups whose perspectives will be crucial to include? So when we were coming up with the Trauma Informed Care Task Force, the legislation actually, you know, it's about a 40-person body who's actually appointed by the mayor and you know, nominated and passed by city council. So it's 40 people who have like the appointment role. And then we also have a number of staff that we're hiring through Healing City Baltimore. And then of course, it's an open meeting, right? We want everybody to engage the entire community. So we've also created a lot of work groups and we allow for an open door policy with the community to attend as many meetings as they want and stay connected. And really, it doesn't matter whether you've been formally appointed or whether you're just like an interested community member who's attending our meetings. We really like tap into however much experience and expertise and time people really want to give, and really like honor that when we're thinking about just the body of work and like who will be doing what. But going all the way back to the beginning, it was just a really, really intentional effort of mapping out, you know, whose experience are we actually trying to elevate in this space. We really thought intentionally about like, what are the types of identities, experiences and personalities that need to be elevated. We also considered just like, you know, intersectionality, and we isolated really focusing on equity around race and equity around gender and geographical affiliation. In Baltimore, we have what we call the white L and the black butterfly, and a lot of like affluent people live in the white L. So of course we wanted to be intentional with really tapping into the black butterfly, going to the people that are normally, you know, not invited and included in these types of shared decision-making, scientific, just like community engagement activities. We also considered like who holds systemic privilege and who can actually benefit the most from participating as you all know, like people who have more degrees, people who have more money, people who have more power, typically get invited kind of like on a rotational cycle to all of these opportunities. And there's actually people who have way more knowledge about community context, and actually have really, really good ideas, sometimes even better ideas than the scientific community. And they just never get a seat at the decision-making table. So we really wanted to disrupt that inequity. And we really wanted to create just a shared decision-making structure and really bring people who, are Black, people who are from Baltimore, people who are coming from every single sector, of course, paying special attention to just geographical boundaries. And also just thinking about like healing. In Baltimore, a lot of people go to beauticians and barbershops, and that's actually a therapeutic space. They go and get their hair done, and they have a conversation with the person who's doing their hair. Sometimes they're in that seat for 3-4 hours. So we really wanted to kind of like reject all of the traditional assumptions and notions we make about who is healing, and really shift, power and privilege to people like our beauticians, like our barbers, and really like invite them to enter, this like collaborative effort around helping the city heal. So that's one specific example and one specific way that we've been really intentional about coming up with a solid, equitable engagement plan. And then of course we, went back to the drawing board and we're like, okay, now that we've identified this criteria and recruited these people, did it actually line up with the demographic and population that we wanted to reach? And when we noticed that in some ways it did not, we actually leaned on trusted community leaders, people outside of our networks to help us keep recruiting people that we might have just missed and not known about simply because they weren't in our network.
Thank you. Thank you for that. And one of the things you mentioned made me also think about, it's great to like get people to the table, but you also need to make sure that the table is equitable in a way too, because you need to find that balance where like people feel like people realize and recognize the power that their voice and their experience has, especially when you're, if you're somebody who like doesn't have that education and all those credentials after their names, like that their experience and that their input is just as valid and just as important as the person they're sitting next to them who has that like PhD or that MPH or whatever, and working with people like those people to like make sure that they're making that space for folks too. So I'm going to throw this question back out to the person with the PhD in their name, Kathryn. What about you? Are there any, as you've done this work and as you've kind of worked with folks in the community, can you share with us like a specific example also of how you've leveraged contextual or experiential evidence to contribute to decision making? Any specific strategies that you found super helpful?
Absolutely. And actually, so I do have, this is where my slides do jump in real quick.
Oh, sure.
So
yeah.
if those could be pulled up, perfect. So I'm going to actually share a story of how community voice like changed systems in Illinois. And I love sharing this story. So in 2015, we had a Republican governor voted in Illinois, Governor Bruce Rauner, who issued an executive order at the beginning of his administration to, as I stated earlier, reduce the Illinois prison population by 25% in 10 years. And as part of that executive order, he names members of the task force, and I was still in community practice at that time and just beginning my PhD program at the University of Chicago, and asked to join the commission. And it was an incredible experience, first of all, to be invited into that space. All of the task force members were legislatively indicated, so you needed certain elected officials, law enforcement, people representing the courts, corrections, etc. And it was a very evidence-driven conversation in which they brought research experts to the table for each convening to talk about the sentencing policy or the criminal justice reform topic that we were addressing. So one of the longest meetings that we had was on truth in sentencing in Illinois, which previously, most states, I think over 75% of states currently still have truth in sentencing policies, which indicate that for individuals who were convicted of certain crimes, you are going to serve 100% of the time indicated on your sentence in a correctional institution. Previously, you could earn what they called good time or meritorious credits for completing programs, for good behavior, etc., while you were serving your time, that could result in a reduction in your sentence. So numerous criminologists have indicated that the implementation of truth in sentencing policies has bloated most of our state prisons. It's been one of the driving factors to increase that has increased the growth observed in state prison populations, because people are spending their entire sentence in a correctional facility. So we had national experts come in and talk about the origin of truth in sentencing policy. They gave us examples of other states who had amended or eliminated their truth in sentencing policies. And all of the experts, research and governmental, that we brought to the table suggested that Illinois could benefit from eliminating its truth in sentencing policy and thinking about another kind of sentencing policy mechanism that would both sustain and enhance public safety and increase access to rehabilitative opportunities and programming in prison facilities and reduce prison populations. So at the very end of the commission, we had to vote on these measures that were then going to be put in front of the governor to either sign into recommendation or not. And we came to truth in sentencing, and we were going around the table. People had one last chance to express opinions or ask questions. And one of my fellow commissioners said, I just have a problem with this policy because I think it's not fair to victims if we eliminate truth in sentencing. And what shocked me at that moment was that we had just gone through all this research evidence, and then a single person's comment changed the entire tone of the conversation afterwards. And it ended up being that one comment resulted in the majority not voting to eliminate truth in sentencing in the state of Illinois. And I looked up this individual's voting record and their legislative agenda. And as part of their legislative agenda, is indicated here, is the individual standing behind the podium. They wanted to reinstate the death penalty in Illinois as well, for high profile cases of children or law enforcement being killed. And so with this personal opinion statement, I just don't think that's fair for victims. All the evidence went out the window. And I tried to counteract that by saying, as somebody who was in community practice, that perspective was not unilaterally shared by all survivors that I had worked with, that more punishment provides more healing for them, or that's what justice means to survivors. And then I got challenged saying, well, where's your evidence? Which I felt was honestly unfair, because I said, well, where was his evidence in his statement? So taking that experience with me, and well, what do survivors actually want? What do victims actually want of the criminal justice system, especially in cases when somebody's life has been taken violently, right? I did an audio recording project. Why did I choose an audio recording project? Because I recognized I could not transport the entire south and west side of Chicago into these task force meetings, right? Because of space limitations, because of limitations on community voice and public commentary and everything like that. But I thought at the very minimum, I can create a platform in which survivor perspectives could be heard on this very topic. And so with a fellow social worker, we went out and we interviewed 50 families who had lost a loved one to violence. And we also interviewed 50 families who had a loved one incarcerated for a violent crime. most of them, it was murder. And we asked them the same questions. We said, can you tell us what happened? And then what does justice mean to you after having survived this horrific experience of losing somebody to violence or knowing that your loved one took somebody else's life? And I'm going to share a snippet of one of these audio clips. And let me just provide some context. This is a mother of a homicide victim. All right. And they found the person responsible for her son's death. And it came down to the sentencing of the gentleman who was responsible for her son's death. And she found in her experience, and you can hear all of this on SoundCloud for free. So this is another one of those free websites, that the prosecutor was kept trying to inject an agenda into her narrative at the trial. And so she said, this is what I want. I want to actually plead for leniency in my son's case, but I want to read a victim impact statement, which is not typical in a plea bargain, especially for murder cases, because I want people to hear my voice. And so this is her voice at the sentencing of her son's murder. And so we'll hear this 2-minute clip, and then I'm going to describe the outcome of this and how she literally changed systems. So we can play the recording now.
You know, they swore me in like I was a witness, and I read the statement, and I was looking at him, and we made eye contact on more than one occasion. That did talk about the pain because it's painful. It's a loss for myself and his children. And so I did share that. I also said that even though I don't know what happened that day, there's just 2 things that I know for sure. And one is that Darren didn't deserve to die for making the worst decision of his life. And he doesn't deserve to spend any more time in jail for making the worst decision of his. I said, Your Honor, I just ask if you would show leniency in your sentencing for this young man. Someone will always be in position to speak up for my son, but nobody's here to speak up for you today. So I'm going to do it. When I finished with the statement, I went back to my seat and I broke down and cried because I was so relieved, because I had said what I wanted to say to him and to his mother. I expressed unconditional love in that moment, and I wanted them to see it. I wanted them to know it. I wanted them to feel it. The judge nodded in agreement with my request, but I don't think I actually believed that he would do what I asked him to do, but he did. And the sentencing came down to second-degree murder, 15 years at 50%, which is 7.5, 4 years already served. Release date sometime 2019. We were sitting on the bench. He was shackled hands and feet, and his attorney got up to help him get up. He had to pull the chair out, and Michael stood up. He turned to walk through the door. He stopped for a moment, and his attorney was holding his shoulder, and he looked back at me, and he said, "Thank you." Then he walked out the door. I still, get kind of chill bumpy just thinking about it, because it was an amazing, amazing moment. And again, it said to me that I did what I was supposed to do.
So again, and I know you're getting a little snippet of this really beautiful recording. And the full link will be provided to you that shares the full narrative. But if we could go to the next slide. So I played this recording at the final criminal justice, or the Commission on Criminal Justice and Sentencing Reform convening. And a judge shared to me, who was on the commission, said, in all my time on the bench, I've never heard of a victim plead for leniency in the sentencing of an individual. And I didn't have to respond at that point. Miss Daniels, Lisa Daniels, was in the audience, and she asked respectfully, well, have you ever given them the chance to? In that audience, also at the same time, was the chair of the Illinois Prisoner Review Board. And the Illinois Prisoner Review Board is an entity that approves the releases of individuals from our state correctional facilities and also hears oversees any parole violation hearings. So they are essential gatekeepers for those coming out and potentially coming back into our state penitentiaries. The chair approached Ms. Daniels at the conclusion of that meeting and said, "Have you ever thought about serving on the Illinois Prisoner Review Board?" And just a year later, she was appointed as one of the 3 new members of the Illinois Prisoner Review Board. You could probably note in that narrative that she shared with us, the brief clipping, that she is a practitioner of restorative justice. She understands trauma. She understands intergenerational harm. She understands the importance of community voice. So she may have been the first person or among the first people to serve on the Illinois Prisoner Review Board who brought that perspective, that community perspective, that not all survivors endorsed more punishment as a mechanism for their own personal healing, who practiced through a restorative lens, who advocated for community voice. And she served on the Illinois Prisoner Review Board for 4 years, at the conclusion of which she launched her own organization, the Darren B. Easterling Center for Restorative Practice. And last year, she was the national keynote speaker for the Office of Victims of Crime, National Crime Victims' Rights Week in the Rose Garden. So this is an example that I love lifting up of how bringing community voice, bringing contextual experience, bringing experiential wisdom to the table can change systems. She literally changed a system. The Illinois Prisoner Review Board during the time of her tenure changed dramatically. And I'm really honored to share her example and also to continue to collaborate with Ms. Daniels in Chicago on a variety of initiatives.
Thank you. Thank you both for sharing the stories that you did, and Kathryn for sharing that audio clip. Very, very powerful what one person's voice can do, and just makes me realize that if we're able to leverage like all of our voices, right, like how much change we can possibly have happen in our communities. Please, folks, add questions to the chat, and we'll be popping in and checking out if anybody has any questions for our speakers. But I want to kind of move to a next question, which is something that comes up a lot when we're talking to folks about contextual and experiential evidence and lifting up community voice. And that's, you know, we're able to do a lot in terms of making sure that people can use their voice and can tell their stories to have impact. But I guess one of the big questions I have is around, like, you know, it takes 2 people, right? Like, you need somebody to share the message, but you need somebody to listen to the message and get the message and make change happen, right? So how can community members or advocates or community-based organizations, how can they get the institutions, the agencies that they're working with to the point of making sure that they're valuing that kind of qualitative data, and not over rely on scientific rigor? Or like, how do we move them to actually not just listen to community voice and make space for community voice, but like, how do we actually get them to really listen to it and then take it into account when they're making decisions? And so I'll start again here with Fareeha and see what wisdom you have to share with us.
Yeah, thank you. And I'm thinking of 2 specific instances where we're really able to harness lived experience and people power to hold different organizations and institutions responsible for just doing better, quite frankly. One story that comes to mind is we have a crisis response organization in Baltimore. And, you know, we were getting a lot of plans from like the behavioral health collaborative across the city, and they were portraying a very like rosy idealized picture of the program and its outcomes. And so we really wanted to look at it from like a critical inquiry standpoint, and we wanted to really also get the experiences of like people who had actually leaned on that organization for support and resources, just to get the full story of like, how effective that organization really was. And we actually invited people who had actually had like direct experience contacting that organization and working with that organization to just share, strengths, gaps, opportunities for improvement. From there, we actually learned that the reality on the ground was like very different than what was being given to us from like the leadership team. And I think like oftentimes members of the leadership team are so busy with like strategic planning decisions that they don't have time to actually be like boots on the ground, walking in community. So I'm not saying that they were like ill-intentioned. I think it's just different positionalities lend themselves to see different just like sides of the story and just to view the system differently. So in those conversations with people, we learned that when they were calling the crisis response intervention line, they were actually getting diverted to the police. And when they were having like acute mental health episodes, police officers were actually coming out. Police that had not actually gone through training around trauma-informed care, did not know how to be like culturally relevant and engage with people. And what I also know from being a special educator in Baltimore City is that we have a disproportionate number of individuals who actually have disabilities. And it's a really interesting just dynamic to see people who have disabilities not know how to really engage with the police and then end up getting further traumatized and even sometimes ending up in the criminal justice system as a result of advocating for their own mental health needs. So when I started like talking to people on the ground and I learned that they were calling a crisis response intervention line, and actually instead of getting like mental health supports, instead of getting a social worker or a peer with lived experience or a substance use peer navigator to arrive on site to assist them or to like connect them with resources, police were showing up and they were getting re-traumatized, sometimes arrested. And that just made us go, this isn't right. How can we use our collective just experience and our collective people power on the Trauma-Informed Care Task Force to really like bring this to light? So that's exactly what we did. We connected the director of the organization with individuals who had actually contacted the organization for services and supports. And through there, we learned just the challenges around like budget and staffing and how they really did not have the appropriate budget to be bringing people with lived experience to actually like respond to clients who are calling. So then we realized this is actually a bigger problem, and how can we tap into local government to really like make sure we're prioritizing a budget, to have like people who have lived experience, peer navigators, people with mental health, just clinician backgrounds to come and respond. So, through the power, it wasn't easy. It wasn't one conversation. It wasn't even 2 or 3 conversations. It was honestly just harnessing the collective experience and just the people power on the task force. And something else the task force I'm really proud of is that we didn't execute this decision just because it was a widely and deeply felt issue for 1 or 2 individuals. We really elevated the concerns that the directly impacted individuals were bringing to the entire task force. And we actually voted first as a policy subcommittee and then actually as a trauma-informed care task force. And what is so unique in this dynamic and just in our decision-making is that we don't go based on like people's titles. It's not just like me as the chair gets to do whatever I want with the task force or as a politician. Really like leveraging people power and building like shared decision-making and really democratizing decision-making on a task force. And we actually were very successful. We were able to get $1.5 million more added to that organization's budget. And we actually had the organization come back and present to us and show us just like how they were using that $1.5 million to expand their staff and how they were actually piloting a 911 diversion and bringing people with lived experience and bringing people who had backgrounds with supporting people who are going through these difficulties, actually connecting them to the callers who were calling. And so far, all the pilot data has been really, really promising. And I'm hoping we can use the early data points that we have just to keep advocating to really memorialize the budget that, you know, the city is giving to this particular organization. Another example I think of is as part of the Trauma-Informed Care Task Force, we're actually charged with working with all city agencies, analyzing their current policies, practices, and really thinking through which policies and practices are traumatizing people, which ones are harmful and perpetuating inequity, and really giving recommendations for more equitable practices. And we do that again through our decision-making structure. So when we worked with the Enoch Pratt Library System, at the time, that was one of the first lead agencies that we actually went to, because we realized so many people are visiting the library actually were more people that are actually going into like the health department or city government. It was a trusted community space. Even during the pandemic, when everywhere else was closed, people went to the libraries to get test kits, to get internet, to get access to social workers. And so we met with the library system and we heard from them that they were actually fostering zero tolerance policies. When people did not have a home, when people were using different substances, they were actually just kicked out of the library and there was no room for them to go. And through our conversations and through our trauma-informed care training with the library system actually realized the unintended consequences of what they were doing. And the fact that just because they pushed people out of the four walls of their library system does not mean that the problems actually go away out in community. So we partnered with them and we were like, hey, how can we help you? What challenges are you noticing? And through that, we actually created a peer navigator program at one library branch that has now expanded to over 7 different library branches. And now we have people who, Donna Bruce, she actually lost her son to the opioid epidemic. And now she's actually coordinating the peer navigator program at our library system. And she's honestly saving lives every single week. And she's coordinating efforts, not just in the original pilot library that we started, but in all the libraries that this program is expanded to. And we realized we didn't have the resources at the local level to implement this program on our own. So we partnered with Care First and they actually helped bring a grant so that we could just continue amplifying and scaling this work. So those are just 2 stories that really show how we just leverage the lived experiences of our community members and just use like the people power of the task force to really hold institutions accountable, whether it's the mayor's office and city council and passing the budget, whether it's local community-based organizations who are just working in the community violence interruption landscape in Baltimore, or whether it's actual city agencies like our Enoch Pratt Library System.
That's really great. Thank you for sharing that. And it's kind of making me realize that this is work that it's important to be consistent and it's important to be persistent, right? Like you need to kind of keep at it. Kathryn, same question for you, and then I've got one final wrap-up question for us after this. But Kathryn, how can community members and advocates and CBOs work with the institutions to make sure that those institutions are valuing community voice and lived experience and experiential evidence in the work that they're doing?
Yeah, I love this question, and something that Fareeha said prescribes to like an organizing principle for like, community organizers often say there's no such thing as a permanent friend or permanent enemy, that like everybody can be a part of a change at the community level or system level. So the library had, in Fareeha's example, became a point of contention because that they were pushing people out of a safe space. And rather than like they could have like led sit in, there's like all sorts of organizing tactics to call that out, which all have a purpose, right? Bringing attention to it, bringing media attention, but they also like brought them in, and said, what are the issues and how can we support you in better and creating more welcoming, supportive space for those who are homeless or whose housing situation is precarious. I love that example. so now as that relates to research, I actually think it's a similar strategy. What I have found with, especially when dealing with elected officials, is that stats are just more consumer friendly. Elected officials love like bulleted statistics that they can stand up and in a news bite or in a legislative session say, we did this and there was this percentage impact on this issue that we've all been talking about. End of story, like that's great. And coming up and reading thematic analysis that resulted from in-depth qualitative interviews doesn't have that same kind of like, and however, I think that something that can be done that reflects on the example that Fareeha shared is that we can bring elected officials in to the research realm and first educate them that qualitative research is just as rigorous as quantitative research, and that RCTs aren't the only rigorous method of assessing the impact of an intervention or better understanding what works or what doesn't work related to particular social issue. So we need to do our part in educating them into different kinds of evidence and how to intertwine them, like the visual that you provided at the beginning, that braid that I really love. They need to be brought in and learn how to braid different kinds of evidence. The second thing I would recommend is that I think it's worthwhile investing in community advocates to become critical consumers of research as well. So that when research is handed back to them, when an elected official or a funding entity comes to them and says, we want you to implement this evidence-based practice, that they're equipped to critically consume that and decide whether or not it's a good fit for them. An example can be like if they want a manualized intervention, I think community members should be equipped to ask, well, who was this developed by? Who was it developed for? And how was it tested or validated? And if it doesn't seem like a good fit for their community, then they shouldn't be asked to perform it. Just because it'll give them funding for 2 case managers that they so desperately need for their community. So that requires funding sources, elected officials, and community members to all be critical consumers of research as well, so that you can incorporate evidence that may be generated from qualitative research or from experiential evidence as well. So those are my initial thoughts.
Thank you, Kathryn. And just to add on to that, I'm gonna have Sophia share a document that I put together that kind of summarizes some best practices that I've been using. And I love how Kathryn talked about the braiding of evidence-based practices with what like feels right to people who actually hold experiential and contextual evidence. One strategy that we've used in the Trauma-Informed Care Task Force is just as we're thinking about interrupting violence prevention, we have really been working to, of course, braid in evidence-based practices, but we never launched or agreed to an evidence-based practice without listening to and honoring the voices and expertise of those who actually have experiential and contextual evidence. And we really make sure that it feels right and sounds right, and wave in just the characteristics of the community that they're describing into the evidence-based approach. So I also love the visual that the team shared at the beginning of the webinar. And I also wanted to call out participatory action research as just one method of really weaving in experiential and contextual evidence. I think PAR is just a research approach that really involves members of communities in the research process. So it's not just people who have doctorates who are, trained researchers. It's really based on the idea that the best way to understand something is to try to work with people from the community to understand their experience. And work with them to not just understand their experience, but also invite their perspectives into like solutions to address some of the gaps that they're noticing. PAR really emphasizes participation from the community, working together, so acting to help close some gaps. And of course, just like reflecting and continued data collection to make sure that the interventions that we're choosing are actually right and they're actually like, leading to positive results. So that is just one other, research approach and methodology that I really wanted to lift up. And finally, another strategy that we've used on the Trauma-Informed Care Task Force is we've actually worked with reputable institutions. So people like Johns Hopkins, for example, along with a number of other colleges and universities, especially historically Black colleges and universities, we really worked with, these scientific institutions just to prioritize and amplify studies where we're really honoring the voices of those who hold contextual and experiential evidence, so that we're not continuing to perpetuate the narratives of those who, are already deeply entrenched in the scientific community.
Thank you for that. So in the last couple of minutes that we have left, I'd like to pose one last question, and I feel like I'm shortchanging the question just because we don't have a whole lot of time left, but I think it's a really important question. And if you all have any resources on this, feel free to drop them in the chat too. And I'm going to start again with you, Fareeha. As a labor leader, as a community advocate, what are some of the best ways that you've found to engage community members so that their inclusion doesn't feel extractive and that it instead values their time, wisdom, and experience? I know we've probably all heard a lot about, people come in, do focus groups, do interviews with people, and then they leave and people never really kind of like see where that kind of comes from, or what comes of that information. There was a big report and document that came out of Chicago not that long ago that the title was, "Why am I always being researched?" Right? And I think that's a question a lot of folks have. So if you could take just a few minutes before we wrap up, I'd love to hear just a couple of quick thoughts from you around, how do we do that? How do we make sure that folks don't feel like they're being, researched, and that it feels too extractive when we're trying to really engage and lift up their voice and experience?
Yeah, thank you for this question. What a powerful question. And it really goes back to what Kathryn said around community organizing. I'm a community organizer at heart. So naturally, I think a lot of these strategies I was already doing, and I just weaved it into my leadership on the task force. But the biggest strategy that I use is really just building relationships with the people that I'm collaborating with, holding one-on-ones or short 45 or 60-minute conversations where I'm understanding who they are, not just my research interest or the policy that we're trying to close gaps around, but really understanding people at a human level, seeing the humanity in them, having them see the humanity in me. Through that, I can actually start, just building my network, establishing credibility and relationships, and also understanding the areas of interest that people have, and also the gaps that they're noticing from their seats. So that's a really powerful way that I engage just people in their work, by building on their areas of interest. For example, if I have parents complaining about the lack of restorative justice in schools, it's a perfect way for me to actually tap them into the coalition we have. It's a collaboration between the task force, city government, and actually Baltimore City Public Schools, where we're creating a joint resolution around restorative justice. So that's a perfect person to tap into that coalition and really continue amplifying their experience. I also think it's powerful just to simply ask people how they want to be involved and to honor it, and to specifically ask them what is the frequency and duration of their engagement? How much do they want to be involved? Do they want to attend the quarterly coalition meetings? Do they want to attend the task force meetings, which are happening 3 times a month? How can they best engage? What are the best times of the day to engage with it? Is it morning? Is it afternoon? Is it weekends? Is it weekdays? And also just what are the ways in which we are holding engagements? We really try to be intentional about using just a diverse approach, and really holding in-person opportunities as well as virtual opportunities, because we know that, not everybody has access to a car. Sometimes it takes 3 or 4 buses to get from one side of the city to the next. So we want to make sure that we're creating equitable conditions. And then I also want to speak very, very quickly to a community engagement continuum that I use. Sophia, would you be able to share your screen? It's my document, and it's going to be the first community engagement continuum on that document. Thank you. And if you just scroll down a little bit to the first framework. Perfect. the first one, and maybe we could zoom in a little bit more so everybody could see it nice and big. Sorry, y'all, it's the teacher and me coming out. So this is a community engagement continuum that's been adopted from the International Association for Public Participation. And I really like using this to understand just the level of community involvement, impact, trust, and communication flow. Of course, the ideal is really creating shared leadership structures like we have on our trauma-informed care task force, but it didn't start off that way. We started with outreach, then we found some people who were like consulting partners. Then we just considered, how can we create bi-directional communication channels from those who are leading the task force and those who have like contextual and experiential evidence. And I think like with every month and every quarter of strategic planning, building relationships, holding one-on-ones, we've actually shifted our practices and gotten more and more to the right-hand side of this framework. I really think the ideal is having the final decision-making happen at the community level rather than like people who already hold institutional knowledge, whether they're like politicians or just people who are like, oftentimes heard and listened to. And I also found that by really empowering people with so much decision-making power, giving them an actual seat at the decision-making table, I found that it was actually really, really possible to form very deep, strong partnership structures that really are lasting us long-term. We're moving into the third year of implementation for the task force. We actually got started during the pandemic, so you can imagine just how difficult it must have been to engage people through the pandemic, a global pandemic. So this is just one framework that I have found really helpful. It acts as my moral compass. And when I'm meeting with people, it also helps me understand the role and just like the ways in which they want to support, whether they want to, just be like a partner that gets our emails, or whether they want to have like a more shared role, whether it's consulting with us, collaborating with us, or of course, having a seat in our meetings at the decision-making table.
Fareeha, thank you so much for sharing that. And Kathryn, do you have another? We've got like 2 minutes left.
All I'm going to do to add to that is the Chicago Beyond report that you referenced. Why am I always being researched? I see also Zachary Anderson, I see your question in the chat. So I actually think that the Chicago Beyond guide around research equity responds really robustly to your question of like, how do I choose the best method for each strategy? And I think it complements really beautifully Fareeha's visual and recommendations.
Great, thank you. And we just both shared the link to that report in the chat. I want to thank both of you. I wish we had like 3 hours, 4 hours to be able to have this conversation, because both of you have so many ideas and suggestions for folks. I hope folks in the audience were able to get a lot of really good really good advice and thoughts and ideas for where to take their work from your comments. Both of you just gave so generously of your time and your wisdom. So really appreciated, really thank you for being able to do that. We will be sharing with folks the slides and the recording of this webinar, so you can share it with folks who might have missed it, or folks that you think would appreciate having this. And I'm going to pass it over to Vibhuti to just close us out.
Wonderful. Thank you so much, both of you, for sharing and sharing your expertise, your experience with everyone. We are so excited to invite you all for our third and last webinar, which will be us sharing our findings and our recommendations from our reports. So we will be sending out a registration link for this soon after this webinar with slides from this webinar and anything. So we look forward to seeing you soon. And thank you so much for joining us from all over the country. We really appreciate you being here and sharing knowledge with us. Thank you.
Thank you, everyone.